Today's discussion on single-sided hearing loss, is it permanent? Is brought to you by Dr. Colin Abrams, and produced by Shirley Media TV. Hearing loss in one ear is known as unilateral hearing loss or single-sided deafness. It also depends on the severity of the hearing loss. The degree of hearing loss can vary widely, but a permanent unilateral hearing loss exists, when a person has mild, moderate or severe hearing loss across frequencies in one ear. In addition, normal hearing ability across frequencies in the other ear. It's generally referred to as single-sided deafness, SSD, when the degree of hearing loss is profound or near profound. People can be born with unilateral hearing loss, or develop it later as a child or adult. When hearing loss in one ear happens suddenly, it requires prompt attention. We were designed to have two ears for a reason. The brain uses both ears to pinpoint the location of a sound, and to improve hearing quality and range. This is known as binaural hearing. Losing hearing in one ear presents unique challenges, depending on the severity of your hearing loss. You cannot always pinpoint where a sound is coming from. Your brain knows where a sound is coming from, by which ear receives the sound first. This is known as sound localization, or directional hearing. When a person can only hear well from one ear, they may have difficulty figuring out where a sound originated. If you are suffering from SSD, you may struggle to hear in noisy environments. Your brain is in charge of selective listening, meaning, filtering out noises that aren't useful. This is tougher to do without the aid of a second ear. In a noisy environment, a person with SSD can struggle to focus on a single person's voice. You may have a harder time telling how loud a sound is. The brain hears a sound more loudly when it's perceived through both ears than if the same sound at the same decibel were only perceived through one ear. This is because the brain receives signals from the nerves located in both ears and uses this information to process sounds. You may have a difficult time or even struggle to multitask. Single-sided deafness increases cognitive load on the brain. The more noise there is, the longer it takes your brain to focus on the tasks at hand. If you're also trying to listen to someone speak, you may miss a significant amount of what is being said. If you have single-sided deafness, you will likely experience something known as the head shadow effect. Due to the way sound waves travel, high-frequency sounds don't bend around to the side of the functional ear, meaning a person never hears them. The head essentially acts as a shield, blocking sounds from the poorer hearing ear from reaching the better hearing ear, explained Cleveland Clinic audiologist Sarah Sidlowski, in an online Zoom discussion with patients. The end result is that speech can sound muffled, because an SSD person cannot hear high-frequency sounds like S or F. 3 main types of hearing loss. 1. Sensorineural. 2. Conductive. 3. Mixed. Sensorineural hearing loss. This is the most common type of hearing loss. It's permanent loss caused by damage to your auditory nerve or the cilia, which are tiny hair-like cells in your inner ear. Meniere's disease can cause sensorineural hearing loss. Conductive hearing loss. Less common than sensorineural hearing loss, is conductive hearing loss. It is caused by an obstruction or damage to your outer or middle ear, that inhibits sound from being conducted to your inner ear. Depending on the cause, conductive hearing loss can be temporary or permanent. Causes can run from wax impaction to a traumatic break in the connection between the bones of the middle ear. Mixed hearing loss. Sometimes hearing loss can be the result of a combination of sensorineural and conductive hearing loss. For example, your sensorineural hearing loss might be complicated by wax impaction. This is called mixed hearing loss. Although modern medical options are limited, your doctor might offer solutions such as traditional hearing aids, bone conduction hearing aids, or bone-anchored implantable devices. Hearing loss can potentially be reversed naturally. The first step in investigating a treatment to restore your hearing is to speak with your doctor. If you decide to try a natural remedy to reverse hearing loss, you should also discuss it with your doctor, to make sure it's appropriate for you. Some natural remedies for hearing loss include the following. Tea tree oil natural remedy. This oil is believed by many to positively treat hearing loss and deafness. You should use this remedy with caution and be sure to mention it to your doctor before attempting to use it. You can mix and then heat the following: 3 drops tea tree oil, 2 tablespoons olive oil, 1 teaspoon colloidal vinegar, 1 teaspoon apple cider vinegar. Then place the mixture into your ears and sit still for approximately 5 minutes. Proponents of the tea tree oil remedy claim that if you do this 4 times per day, you'll see results as quickly as 2 days. The Kajaput Essential Oil Natural Remedy. Some believers of natural treatment suggest Kajaput essential oil can reverse hearing loss naturally. You are told to massage a few drops of Kajaput essential oil behind and in front of your ears, to improve your ability to hear. Ear irrigation. You should never attempt to remove earwax buildup by yourself using Q-tips. This can cause major damage to your ear and lead to infection or hearing loss. However, you'll often be able to get rid of excess earwax yourself using the irrigation method. Only use cotton swabs on the outer portion of your ears if necessary. Never attempt to irrigate your ear if you have an ear injury or have had a medical procedure done on your ear. Irrigation of a ruptured eardrum could cause hearing loss or infection. To properly irrigate your ear, follow the directions provided with an over-the-counter irrigation kit. It might be necessary to do this irrigating procedure several times. If you often deal with wax buildup, routine ear irrigations may help prevent the condition. I hope this video was informative to you, and thanks for watching the Dr. Colin Abrams wellness review of single-side hearing loss. Is it permanent? With an article contribution by J.C. Jones, on Shirley Media TV. If you enjoy watching the content of this channel, please hit the subscribe button to see more videos of Dr. Abrams health and wellness reviews. And don't forget to hit the like button, and turn on the notification bell to alert you whenever we post new content. Thank you once again, for watching. And may God bless.